Hi, everybody. This is Robyn here with Scaling Up, and I am wanting to share some information with you about our acute stress syndrome stabilization procedures, otherwise known as the ASSYST. By now, you have already seen our posts and emails going out about our 2024 schedule, and we have a few live training options for our ASSYST training that you can partake online live throughout 2024. We also have our on-demand options still available year-round. But I'm not here to talk about that necessarily. I want to talk about a couple of ways that you can utilize the ASSYST in your practice, in your agency, in your community, or in humanitarian work. And really, it's about how to conceptualize the way that the ASSYST can work beyond kind of what we talk about generally in the past, or kind of how we have framed things before, because we have been learning and growing along with the ASSYST, and everything that Dr. Nacho Herrero is learning as he continues to research and utilize the ASSYST in various settings. So I want to talk about three things: treat, triage, and transform. So first we have treat. The ASSYST is excellent at treating the manifestations of distressing symptoms or intrusive symptoms. These can be sensory, emotional symptoms, and cognitive symptoms as well, but that are really getting in the way of how folks are managing their day-to-day, showing up in their relationships, because the symptoms of whatever is causing all of it are just really wreaking havoc. And so the ASSYST is wonderful at treating those symptoms in a way that is helping them to not just put a Band-Aid on, not just put a set of coping skills on, but to, in a sense, work with the nervous system to get it back to a place where the amygdala and all the fight or flight responses are not driving the bus all of the time. So it is a nervous system regulation procedure. It is something that works bottom up, and it's fabulous for helping people immediately after an adverse experience, let's say an earthquake, or immediately following some really bad news that someone received from a family member, other traumatic events. And it's also really great at helping folks who are coming in to your office, your clinic, your agency, and they had something going on. Maybe you don't know exactly what it is, but they are just super activated. Maybe you've been working with them for a long time, or you are getting ready to do some more deep trauma work or deep therapeutic work. That the idea of doing that is creating a lot of distress. You can utilize the ASSYST to help their nervous system get back to a place where they feel more supported in their window of tolerance or in their capacity to hold whatever they need to hold for the next phase of their treatment or their clinical work with you. So it's not just something that is used in the field in response to a catastrophe or a tragedy, though it is excellent at that, and we've talked at length about how the ASSYST helps in those situations. But it also helps in many different situations where your client is experiencing any sort of somatic, emotional, psychological activation, and it's really hard for them to get the other aspects of their brain and body on board to continue doing the work that you're doing. So you can treat those things as well. Additionally, the ASSYST, the second one, triage. The ASSYST is a fabulous triage tool. I think we shared a few weeks ago about our interview with an amazing school social worker, Patty, in Canada, who is using the ASSYST in schools. But a lot of folks have been telling us how they're using the ASSYST also as a triage tool. So treat whatever is happening, treat whatever intrusive symptom distress is there, but then use that to triage what would the client or what does the person need next? Does the person need a higher level of care? Meaning, let's say you're doing this in a community context and you're responding to a community crisis, or a school crisis or a workplace crisis, something happened. Is this what the person needs? Do the person need one-on-one? Do they need like the ASSYST individual? Do they need to be connected to a clinical therapist? Maybe they don't have one. Do they need some sort of social supports? The ASSYST helps you utilize that, because when you're able to take down that level of distress that is kind of front and center, when you're able to lower that in a way that your client is able to explain a little bit more about what they're experiencing, have a greater understanding of maybe what their next level needs might be, then you can find the type of care or support or resources that best meets their needs. This directly, the first, treat, and transform directly tie into the third awesome quality of the ASSYST, which is transform. Utilizing the ASSYST in these two ways can help transform the way that you might be conceptualizing how a person might need, or what types of mental health care they need, or other social supports and resources they might need. Because when someone is coming in after a distressing event, whatever that might be, it is hard to see past that. And sometimes our recommendations might be very different in response to that, versus once that nervous system has some soothing, has some time to re-regulate, and hopefully as a result prevent any long-term kind of setting in of post-traumatic stress type symptoms, or heightened, more longer term anxiety. So the ASSYST helps it to prevent some of that as well. So when you're able to do that, you're able to move in a way forward with a treatment plan or a community resource plan that meets the needs of the person after they've already had the intrusive symptoms kind of dealt with in a way that is really quick and not as intensive as some other interventions that we might be utilizing. So in that sense, it can transform the way that you're viewing what your client might need or what the community member might need. And it transforms how you carry out your treatment plan as well. Like if you are using other evidence-based practices or other mental health interventions, you can plan out how might the ASSYST play a role in your SAM tray, or play a role in EMDR processing, or play a role in brain spotting or DBT, knowing that at any time when we are working with clients, we get another level deeper, or something happens in their family or their work environment that triggers something, and they are feeling really in a lot of distress and there's a lot of intrusive symptoms. You can treat that with the ASSYST procedures and then continue moving forward with whatever treatment plan steps you have in place, or make adjustments as necessary. But it's not something that has to derail the whole process or mean like, oh my goodness, my client is in such distress, I can't, what do I do with this? I'm not equipped for this. I have no idea. The ASSYST helps that as well, because utilizing it is a really wonderful tool for providers as well, because it is something that is relatively simple. It relies on the adaptive information processing, which is a theory of how our brains process information towards adaptation, towards healing, towards well-being, towards health. There's a lot of research on that if you want to learn more about the AIP. But the ASSYST is wonderful at that, so that you can feel confident in meeting your clients where they're at, even when they're experiencing higher levels of distress than maybe you were expecting, or maybe that you were prior to learning the ASSYST, you felt really equipped to handle and support a client through. So the ASSYST procedures are wonderful at treating those intrusive symptoms and the manifestation somatically, emotionally, and cognitively so that they are no longer interrupting their lives, hopefully to prevent maybe some trauma setting in or prevent an increase in anxiety or depression or other symptoms long term. And also it can help to triage next steps for your client or the community member and determine like what do we do next. Maybe this person is great and they don't need anything else right now. They needed to deal with the events that just occurred, and doing so prevented any long-term mental distress or emotional distress. And so maybe just connecting them with some follow-up resources in their community or other community supports, or maybe nothing at all, or maybe referring them to a higher level of care or to a provider if they don't have one already. And it can transform the way that you engage in your community and engage in your practice and your clients by giving you a really, really strong and effective tool for helping clients through distressing times without completely kind of shifting or needing to change the treatment plan. Or, have to, call in, a secondary provider or something because you don't feel equipped. So it equips you with being able to help folks in those distressing times. So hop on our website, scalingupemdr.com, and check out our ASSYST training dates that we have coming up in 2024 if you want to hop on a live one-day training, or you can sign up for our ASSYST Procedures complete on-demand training online on our website as well. If you have any questions, you can always reach out to us at info@scalingupemdr.com. All right, we'll see you all soon.